Well, thank you, and thank you for that introduction, and thank you so much for having the National Alliance to End Homelessness here at your program to provide a little bit of a national overlay and a generalist perspective on some of the issues that Sam raised. At the National Alliance to End Homelessness, we believe that communities can end homelessness. We believe that the nation can end homelessness. And we believe that homelessness should be ended as soon as possible because the human costs are too great. And the burden on public resources is just unjustified, particularly given what we know can be accomplished. So just in the interest of time, I'm going to focus on two groups of homeless people who I think have what we think a lot to do with that burden on the public resources. And that's homeless families, and then I'll say a little bit more about chronically homeless people as well. Well, so homeless families tend to be young women with young children, although certainly in this economy, communities everywhere are seeing intact families become homeless. And they're homeless because they lack access to affordable housing. And so therefore, really, the primary intervention to help them is to get them into permanent housing as quickly as possible. There's a term that's come up in this area called rapid rehousing that's meant to cover the intervention of, as soon as a homeless family is identified, working to get that family into appropriate housing that's going to be permanent. And sometimes it's also a preventive measure as well, intervening before an eviction happens or before a family has to leave their home. And so the primary public assistance is in the form of rent subsidies or vouchers, sometimes, usually very short term, sometimes just a one-time support for move-in costs like a deposit, first and last month's rent, sometimes just help negotiating with the landlord. And so what we find is that if that kind of intervention happens quickly enough, for most families, that's really all that's going to be needed, and that family will have had one episode of homelessness and will continue sustained in permanent housing. Occasionally, a family needs a little bit more support to go along with that, and in what you would imagine, it's looking at perhaps job search assistance, job training, maybe some help with child care, again, negotiating financial literacy kinds of requirements for getting along and other skills for living independently. And so communities that have really achieved a lot with rapid rehousing find that their homelessness does decrease. I talk first about Norfolk, Virginia, which over a period of time looked at a lot of different ways to address their family homelessness and very much committed itself to this notion of rapid rehousing and getting families immediately into a permanent place to live. Over a couple of years, their rate of family homelessness declined by 25%. In 2007, about the middle of their project, they housed 888 families in permanent housing and had a very high retention rate. So in other words, a year later, very few of those families had had another episode of homelessness. Up the road in Fairfax County, which is near where I live, also wanted to follow Norfolk's example and instituted a rapid rehousing program. Actually took some of their transitional housing and consciously decided to convert it to permanent housing and to get homeless families into those units. Their homelessness has decreased 16% since 2008. I brought an article that was just published yesterday in our Washington Post. I don't know if I have enough copies, but some of you may have seen it. Just very basically lays out what the community commitment did to bring this about. Another city where success is often examined is Hennepin County, which is the populous area around the Minneapolis-St. Paul. Several years ago, really at a very multilateral way through city, county, state, set about to change their entire system and turn it the other way around so that housing is the priority intervention and then services around that to make housing sustainable for those individuals. So the other thing you see, though, in addition to this emphasis on priority housing first, is simply more coordination. Coordination at the service provider level, for instance, in Fairfax County, where they actually were working with 3 jurisdictions, Fairfax County, Fairfax City, and the City of Falls Church. They really were all dealing with homeless populations, and sometimes the same families all at the same time. And so they made a commitment to bring the providers together, have a common data source, a common intake and referral system. And so they are able to really assign roles a lot more clearly among all the stakeholders in that area. And so it goes up to a coordinated planning level as well when you have multiple jurisdictions and also multiple funding sources. You're dealing with federal money, state money, county money. So housing first, and then really the community level commitment to pull all the pieces together in the most rational and organized way to maximize the resources. Now, with the chronically homeless population, a little bit different, more services required usually, as Sam mentioned, and we all know chronically homeless individuals and what their challenges are. If they're dealing with severe mental illness or substance use and dependence, sometimes physical disability. On top of that, these conditions happening all at once, all add the long-term economic displacement that comes from sometimes even having one encounter with the justice system. And so what we see with these individuals as well is they are homeless because they need a place to live. The chronically homeless person needs a place to stay, and the services literally that will enable him to stay there, whether it's the mental health services, the recovery, access to primary care, and some skills for independent living. And what we find in communities who have been able, through what's known as permanent supportive housing, to pair housing with the right services in the right amount at the right time for that individual, that they've not only decreased their rates of chronic homelessness, but also very significantly reduced the public costs associated with caring for these individuals otherwise, which is usually in the form of emergency room and unnecessary hospitalizations, certainly in the public safety sector with the use of jail, which is an unintentional but certainly a real strategy for dealing with homelessness in a lot of communities and really needs to be addressed, and the cost of police. So I can point to cities like Portland, Maine, where they instituted a permanent supportive housing demonstration, housed chronically homeless people first, wrapped services around, and they documented a 60% decrease in across all of the costs of services normally used to take care of folks who are homeless, chronically homeless. In Portland, Oregon, the same intentionally reached out to chronically homeless individuals, particularly ones with mental illness and substance abuse, matched them with the right services, in permanent supportive housing, and were able, within a year, to bring the annual medical and public safety costs down that was attributed to those individuals. This evidence just comes up everywhere. It's documented very well in Denver and most recently in Utah. And so we think that Housing First really does work and really will show results in communities. And we think it really is part of the reason why we're seeing what seem to be somewhat encouraging data, although we'll talk about that in a minute too. But overall in the country, chronic homelessness has decreased 11% since 2007. And we just see it come down everywhere when the housing is made available and when the appropriate services and the appropriate amount are made available. And usually the services for chronically homeless individuals will include some kind of a social component that we call case management or targeted case management or care coordination. Essentially is someone who is able to work that case, but able to work it in a very meaningful way, which means social services capacity, obviously. required. So we've seen homelessness overall in the most recent report went up just a little bit between 2009 to 2010, but behind those numbers there's some very troubling things. First, about the families. Clearly, family homelessness is moving from cities into suburbs. And there are many, many communities that have seen increases in the size of families that are homeless, which I think indicates some intact families and maybe multi-generations in a homeless family. A lot of the success is really coming from permanent supportive housing on the chronic side. And so the communities need to pay attention to family homelessness. There's some concern that we're going to lose some momentum that we've gained in recent years because of cuts to housing services and to other public services. And so when Section 8 is cut, it results perhaps in more homelessness, and then when cuts are made directly to housing assistance that helps homeless people, there's a real concern of what's going to be happening in the years ahead. So I don't want to end on that completely pessimistic note, because we have seen sustained commitment in communities and in states and the federal government, and we've seen and heard public champions, and you're lucky to have them here, and bipartisan support really in some important policies. And homeless and at-risk people need that momentum to continue. And I'm really looking forward to hearing more about what's going on right here in Bergen County. Thank you.